Now, CO2 lasers, they definitely hurt. So I'm not gonna argue with that point. And it depends on what kind of settings we're using. So the really aggressive settings that actually do get a really good result, they hurt without question. Here's how I manage that. So if you have a look at our patient here, I do full face nerve blocks. So I know that the nerves come out here, that is the infraorbital nerve. There are the supratrochlear and supraorbital nerves that come out around here. There's also nerves that travel up around the nose here. And there's nerves around here, the mental nerve on each side, and also the zygomaticofacial nerves that kind of run around here. There are also nerves that run deep around the muscle here. What I do is I do nerve blocks to those areas. So I do injections in here, I block around here, I block here, I block here, and then I make the face completely numb. So without those injections, definitely this is a really painful treatment. And the more aggressive we go with this, sometimes there's been cases where people get a general anesthetic for this when we do full face ablative lasers because they are so painful. We like to do them just under local nerve blocks because we find that's the best way to manage our pain. In terms of does this treatment work, it depends on how aggressive you go with the laser. So if you go really gentle to the point where it gives you a few hours of downtime, then you don't get much of a result. It's really kind of nice laser facial. If you ablate the top surface layer of the skin and do a really aggressive treatment with 2 to 3 weeks downtime, then you can't help but get a result with this. Of course, the right patient, right indication, in the right areas, delivered with the right settings is required to get the right results, but super effective treatment, gold standard for skin rejuvenation.